this is Dr. Mayberry again. We are going to talk about the ribs. So, the ribs, like the vertebrae, have really similar landmarks. So, you mainly have to be able to recognize the difference between the first rib and the rest of the ribs, and then the landmarks on them. So, let's start with just your basic rib. Basic rib. So, the head is this flat surface here. The neck, just like when we talked about the long bones, the neck is always just beyond the head. So I mentioned when we talked about the long bones that the head is very often rounded. This rib is a little bit unusual looking, so let's look at this one. It's vaguely rounded. It's not as rounded as, say, the humeral head or the femoral head or even the radial head, but it is still rounded. So head and then neck just after that. So those are the first two. Those are the posterior most parts of the ribs. So I should have probably showed you this when I was talking about the thoracic vertebrae, but the ribs, of course, articulate with the thoracic vertebrae. So these aren't necessarily from the same person, but the way that they articulate with the vertebrae is, here's your thoracic vertebrae. You actually have a demifacet that I didn't show you when we did thoracic vertebrae for the rib. And then you have this costal facet here. So a demi is like a half, so it's a half facet right on the edge of the body, because every rib is articulating with the inferior aspect of one vertebrae, so there, and the superior aspect of the next there. And then this is a full costal facet here. So the rib will articulate like this, okay? So the anterior part of the rib is actually the sternal end of the rib. So remember, this is your sternum here on Stan. This is the anterior portion, the sternal end. And so there's costal cartilage in between there. So ribs 1 through 7 are true ribs, which means that they have their own costal cartilage that attaches them to the sternum, which you can see on Stan. Ribs 8, 9, and 10 are false ribs, which just means that they share their costal cartilage, so you can see that here. And then ribs 11 and 12 are floating ribs, which means that they don't have costal cartilage that attaches them to the sternum at all. They're not floating in the same way that the hyoid was floating, so that's, just there. Within soft tissue, of course. These are still articulating with T11 and T12, but in the front, they're not articulating with anything. So you can actually palpate and feel them on your thorax. But they're down here, okay? So 11 and 12 are right down here. You can actually see it better over there. You can see how 12 is not touching anything. So that's a floating rib. So there's that. So let's continue with this. You have your head, you have your neck. This is actually the tubercle, and this tubercle is what's articulating with the transverse process of the thoracic vertebrae, the part that I told you to look for to recognize the thoracic vertebrae. On rib 1, we have a couple of extra landmarks. So you actually have this scalene tuberosity, which is that little bump that you can see right there. Okay, that's very important. That's helping you recognize first rib in itself, but also the superior aspect of the first rib, because a lot of people, especially with the first rib, have a hard time telling what's the top and what's the bottom, which is how we can side the ribs. So you need to find that scalene tubercle, and that helps you know this is the superior aspect, and that's going to help you side it. So you have a scalene muscle that attaches there. And just anterior to it, there is a dip for the subclavian vein, and just posterior to it, there's another dip for the subclavian artery. So you can actually see both of those, right, like that, there and there. So those, you have vein and artery, and then the scalene muscle right in between them. So that's how you can tell the top part, which is important because you're going to have to side these ribs. So if you know that the head and neck are posterior, and you know that the scalene tubercle is superior, then you can side the rib. There's a I won't call it cheating, but there is another way to side the rib as well that a lot of students like. I would recommend, if you use it, you use it as a double checking mechanism. You should always be looking for that scalene tubercle first. But the way that you can do it, pretend this is a table, okay? Sit the rib on the table so that the head is posterior, as if it were in your body. And then you can press on the head, okay? It doesn't move like this. If I flip it up here and I press on the head, you can see that the rib sort of flops around. That's the wrong side. If it moves when you touch the head, it's the wrong side. So this would be my left, so I know that this is a right rib. And indeed, when I find the scalene tubercle and I pretend I'm putting it in here, it is a right rib. So use it to double check. The problem that I have with it more than anything else is that people forget if they're supposed to touch this tubercle or the head. So shoop, shoop, yeah, sure, it moves, but you're only supposed to be touching the head to see if it moves. So sometimes people mess it up, which is why I think that scalene tubercle is more important. Okay, let's see. So that is it for the first rib, which basically sums up the rest of the ribs too. These ribs don't have a scalene tuberosity because they don't have a scalene muscle that does the same thing. What they have is this costal groove. So the costal groove is how you side the rest of these ribs. So the costal groove is actually protective of the intercostal nerve, artery, and vein. It's a bundle that sits right in this groove. And this groove is going around the inferomedial, really, if you want to get technical, aspect of the rib. So it's basically within the thoracic cavity, and they're sort of just bundled in there. So if you can find this, and you can, even if you can't see it, this is a really obvious one, you can see very clearly there, but even if you can't see it, you should be able to feel this sharp edge, and that's always inferior. You still have the head, you still have the neck, you still have the tubercle, so you should know that's the posterior part. This is the sternal end, so it's anterior. So as long as you know that this costal groove is inferior, you're basically good to go. So this would fit in this side, so this is a left. All right, so if I flipped it over and tried to go right, well, the costal groove's up on the top. That's not very protective of that arterial bundle. So that's how you do that. Just so you've seen it, this is the 12th rib, so you can see, there's no, it's not the same rib end, that sternal end, as you have with the true or even the false ribs for the floating rib. So on your test, your lab practical, I would only put the first rib. I wouldn't put like the second, which kind of closely resembles the first. I put that. So you have to side this on the test pretty much always. And you also have to side this on the test pretty much always. But usually not this. You can. Works the same way. But my point is that if I ask for you to be specific about a rib, the first rib is the only one that you need to know. This is absolutely the first rib. This one you should be able to say, this is rib 2 through 10. It's one of them, right? So that's the extent to which you need to know this. So that should sum up our ribs. Let me make sure. Indeed, I have all of the landmarks on there. So all we have left to talk about after this is the skull. So find the links to the skull lectures, or whatever you want to call this, and go through those. Remember that you are supposed to be labeling and studying these for your homework basically every day. So be sure to ask me questions when you have them. See you in class.